All right. Hello, everyone. Thanks for joining us for an impromptu get together this afternoon to speak with Dr. Moreno regarding the implementation of regional stay-home orders. Thanks, Dr. Moreno, for dropping in today and giving us an overview of the decision made and announced today.
Sure. Thanks, Mia. Good afternoon, everyone. I hope that some of you or most of you were able to join the board meeting today where I try to explain what the situation is and why we're moving forward under a new local order that ties us to the state order. This is primarily for anyone that wasn't able to join the board or anyone that has additional questions. I'll do what I can to answer those questions. So the issue is that as many of you are aware, the statewide, we have an increase in cases that is a result of increased transmission in all of our counties, leading to increased positivity rates, which drives up the case rate. As the number of cases increase in Monterey County, more people are getting sick enough that they need to be hospitalized. And in conversations with the state has pointed out that 10 to 30%, up to 30% of people who get hospitalized will eventually wind up in the intensive care unit. And I think the hospitals have, on a few occasions, have explained and very well the course of that progression, the sequences of illness, hospitalization, and ICU level care over time. And so the state, in response to that, did, into the rising cases, put an order in place statewide that, first of all, creates different regions. And Monterey County is in what's called the Bay Area region, along with Santa Cruz County. And stated in the order that should any of the region-wide ICU capacity rates drop below 15%, that further restrictions would be placed on all the counties in that region. Our region still has a calculated ICU capacity around 20%, and it's been as high as I think 25%. But even though it's above 15%, it appears to us and me and my colleagues here in public health that on the region-wide looks like it is decreasing. And when we look at what's going on in Monterey County, we look at data that's posted at the state website as to ICU capacity here just for Monterey County. And it appears that our ICU capacity is trending worse than the region is. And it looks like it is trending down to fewer and fewer ICU beds available. And we have met with hospital representatives, and the hospital representatives have been sharing publicly their situation. So what's actually happening in the hospitals, and does it coincide with what the rates are showing? I think what does coincide is the fact that the beds are filling up and the rate is getting worse. What doesn't coincide is the fact that the beds essentially are filling up and almost full in our hospital, even though the state threshold based on ICU capacity hasn't been met yet. And so we're very much concerned that that if we wait for the state to wait for the region to get to 15% threshold, that it may be very late I don't want to say too late, but I think I would like to say it'd be much more challenging for our hospitals to be able to accept someone from the emergency department that requires hospitalization, ICU care in the near future if we wait till we get to 15%, if we wait till the region gets to 15% ICU capacity. And so given all that information, I feel strongly that we need to take additional steps as a county to reduce transmission of COVID-19, which can reduce the positivity rate, which will help to slow down this rise in case rates and cases, which will then in turn hopefully decrease the number of people who are requiring hospitalization and ICU level care. And so today I did issue a local order. It's actually my order that aligns us with the state health officer stay-at-home order, and which then puts the restrictions that would otherwise occur when the region reaches a 15% capacity, implements that here in Monterey County before we get to that threshold. So we are going to move to more restrictive status starting on Sunday at 10 p.m. That coincides with the state's existing and continuing modified order requiring people who are not involved in essential services or seeking essential services after 10 p.m. to be at home. And it'll last for 4 weeks. And during this time, during the next 3 weeks in particular, we will be continue to meet with our colleagues in the other Bay Area and Central Coast counties to look at what's happening to our ICU, our bed status and ICU capacity throughout the region. And also be looking at any steps that the state may choose to take to prepare to resource the alternative care sites that the state has identified in various locations in our region to support our hospitals. And so I'm very much hoping that we can, this reduction in, these additional restrictions, which will reduce the opportunities for people of different households to gather outside the home, in combination with continued efforts for people and encouragement of people to just stay home and not mix with people who aren't from your household. If we can, do a better job there, then this combination of efforts hopefully will slow down this transmission of COVID-19 and help to protect, to preserve the hospital beds that any one of us could need at any moment from trauma or some other illness that falls upon us and requires hospitalization. Also, it will particularly protect our ICU beds, and that's the highest level of care that we can provide in Monterey County at our hospitals, and also support our healthcare workers. Our healthcare workers are working extremely hard in these hospitals, and they are the ones that we want to be available for us should we need to be hospitalized, and available in sufficient numbers to provide the care that our hospital workers know that they can provide and should be providing to any one of us that's hospitalized. So I'll go ahead and stop there, Maya, and hand it over to you.
Thank you very much. Thanks, Dr. Moreno, for kind of walking us through the events of today. I've already got some questions coming through in chat, and I'm just going to go ahead and take questions. We had initially planned for about a half an hour. If we need to go a little longer, Dr. Moreno, are you available a little bit longer if we have more questions?
I believe so, yes.
Okay. All right, we'll work with your time. All right, let's start with the question then. Dr. Moreno, could the order be extended beyond the current end date, and what would trigger that?
Thank you. So the order that's in place can, I could allow the order to terminate on its own, or I could amend the order during the time of the order, or I could extend the order with or without amendments. It really, it really depends on what happens over the next 3 to 4 weeks. Really over the next 3 weeks, we will see, hopefully we'll see some improvement in transmission rates and hospitalization rates here in Monterey County, as well as the region, now that more counties in our region are aligned with the state's regional stay-home order. So we'll have to follow that, and we will It's not a wait and see. It's a daily looking at the hospital data, look on a daily basis, looking at the state metric, and on a regular basis every week, hearing and communicating with our hospital representatives, and also with our state health officer and her team of public health professionals as to how things are going, what direction we're in, what's working, and what next steps should we take.
Thank you. Another question, assuming the FDA acts tomorrow, when will we start to see vaccines in Monterey County?
Okay, thank you for that question. When do we see vaccines? If I don't get to that, an answer to that question, just remind me. And that's because I want to start with the little background and reminder about vaccines. The vaccines are what we've been hoping for since we were able to identify the cause of this pandemic. And we have been under a variety of restrictive scenarios since the COVID hit the United States. And so we have been sacrificing, working hard, doing what we can to slow down the spread of COVID-19. When we will get vaccine very soon. When we get vaccine, I just want to point out, that's not a time when we can reduce our efforts, thinking that the vaccine is going to fix all this right away. The vaccine will come out in small amounts, and a small percentage of the US population and a small percentage of Monterey County residents will be offered the vaccine when it first comes out, and not enough to begin to significantly reduce transmission. Certainly not enough to allow us to lower our guard and begin to mix with other households. And so we need to continue to implement these infection prevention strategies, even though the vaccine is being made available. So back to the question. So I can share with you that we were notified just recently that in addition to 2,925 doses of the Pfizer vaccine, we're going to be allocated as a county 4,700 doses of the Moderna vaccine. We have to put in our order by the 10th, and we have been working with all 4 of our hospitals, a lot more today, letting them know that there's a deadline, and agreeing upon how those allocations are going to be dispersed and delivered to our various hospitals. So we haven't put in our order yet. We still have some questions from the hospitals that we have yet to answer, but we anticipate putting in our order tomorrow, so that we can take full advantage of the allocation that the state is giving to Monterey County. The last thing we want to do is to submit an order that does not take full advantage of that. So our team here in public health is working closely with the point of contacts for each of the 4 hospitals, and making sure that they understand what's required of them when they accept this vaccine, and that they are ready to implement their plans and protocols to vaccinate the priority group. Again, that's 2,925 Pfizer vaccines and 4,700 Moderna vaccines. The Pfizer vaccine has to be, it's recommended that it be stored in ultra cold freezers, and the Moderna vaccine can be stored either at a normal vaccine freezer for, I believe, up to 6 months, but can also stay within a normal vaccine refrigerator for up to 1 month. So that's the number of doses coming in, and we've been told by the California Department of Public Health that we will be notified on a weekly basis of the next allotments allocations, that will be coming, that will be made available to Monterey County. With these first doses, we are targeting the hospitals, and particularly hospital care workers, healthcare personnel who are at risk of direct or indirect contact with the virus that causes COVID-19. Our hospitals have have priority groups within each of their organizations, and they will be starting, they will begin by offering the COVID vaccine, one or the other, to the individuals that they've identified as the highest priority because of most importantly because of their risk of exposure and risk of contracting COVID-19.
Thank you, Dr. Moreno. Another question for you. Do you agree with Dr. Blum from Community Hospital that there needs to be enforcement of this health order and that law enforcement needs to step up to help reduce the spread? And that is a comment that she made earlier today on a media briefing.
Thank you. So I appreciate Dr. Blum's comments and opinions. I think what she is touching on is an issue that we in public health in all of our counties in California are dealing with, and that is the enforcement. Part of these orders can be or will be enforced through County Board of Supervisor action, which allowed through ordinance our Department of Environmental Health to include as part of their inspections a review of compliance with measures that are required to reduce the transmission of COVID-19. So our Environmental Health Department is currently doing that, and I'll be working with them to make sure that we are in agreement as to what if any, additional compliance measures need to be taken by the various businesses that fall under their jurisdiction. So that's one form of compliance. Another form of compliance is it has been the district attorney, and we do know that the district attorney has not too frequently, but has emphasized with some business owners that if they continue to operate in a manner that's not consistent with the state or local guidance and restrictions, that they have an unfair business advantage over those businesses that are complying. And so that is one other mechanism of compliance, and that is something that I'm working through Charles McKee and Elsa Jimenez will continue to explore and pursue and perhaps apply as applicable. There's also compliance through law enforcement, and each of the orders that I issue and that of the state can be enforced at the local level by the sheriff and the police department, which is I think partly what Dr. Blum may have been alluding to, but that is also an avenue that we have as a county to get compliance. So I do think there are opportunities that for local law enforcement to educate from their position of enforcement, law enforcement specifically. They can continue to educate various businesses and other sectors as to why it's important to comply with these infection control measures. And I think that it is something that we continue to hope for, and that is additional support from law enforcement to, as appropriate, help us out with education and help us with enforcement so that more people understand and do comply with this with these guidance and restrictions. And finally, the last form of enforcement that comes to mind is enforcement by the people. I think that there are, and I've seen and heard many stories of Monterey County residents who want to do the right thing, who want to reduce transmission because they know it's good for each other. It keeps us healthy and prevents us from getting sick. It's also ultimately better for the economy because we can get back to a place where we have fewer restrictions and there's more services available to all of us. And these individuals call out other residents who are not complying and reminding others in our community, why it's important, and so that type of enforcement, encouragement from one community member to another, I think is still an important way for achieving compliance and thus decreasing enforcement. Thanks.
Thank you. Another question, why wait until Sunday evening to begin the order?
So very good question. So when we in conversations with other health officers and communications with the state health officer, we have had discussed how much time the community, in particular the business sector, should have once a decision is made to move into more restrictive status that impacts those various business sectors. And what we learned from earlier this year during the early stages of the pandemic is that businesses do have business decisions to make. They do have important decisions such as purchasing, such as stocking, such as scheduling, employee schedules, a variety of things that they need to make if they're going to modify their business practices or close their business practice. And so one of the things that we have learned and continue to discuss is how much time should businesses have to allow them to minimize the impact during the transition from a less restrictive to a more restrictive state. So given the big picture of how long we've been in this pandemic and how long we're going to continue the pandemic, I think that it's reasonable to give businesses a few days to, again, minimize the impact of the transition on their business and on their employees and on their customers. So I was intending to give 72 hours notice to the business sectors and various sectors that are impacted, but I believe that would fall in the middle of a weekend, so I allowed for Sunday to be included, and that's why this will take effect at the end of the weekend.
Thank you. And also, could you speak more to the issues with the state's formula for calculating ICU capacity? Why is it not translating to what the local hospitals are experiencing?
Certainly. I'll actually, I'll do my best. I can speak about the formula, and I think fairly well. I can, as far as the why it's not matching up with what we're experiencing, I'll just do my best, because I don't know, we didn't invite one of the hospital representatives here to talk about it, but in the communications I've been with, I think I've been in enough communications with our hospital folks that I can attempt to answer that. So the state metric is based on ICU capacity. The state could have included another metric, which would be overall hospital census. Overall hospital census looks at how many beds do you have that you could staff, and how many of those beds are filled, and how much capacity do you have left in terms of beds and staffing for those beds. And in talking with but that's not one of the state metrics, but that is something that every hospital here is very concerned about. When they look at all their beds and the staffing, the doctors, the nurses, the therapists, the ancillary staff, the food services, janitorial, and look at all that, how many beds could they actually properly staff? They're telling us that from that perspective, they don't have much capacity left. And that's not measured. It's not a metric. It's measured, but it's not a metric at the state for determining a region to go into more restrictive status. What is measured is the ICU capacity, and the ICU capacity at the state is set at 15. And so when this 15%, as the threshold to trigger a region going into more restrictive status, when the hospitals report, and they report on a daily basis to, I still believe it's the California Hospital Association, which in turn shares that information with the state, California Department of Public Health, they're primarily reporting on the ICU status. And so the ICU status can vary from day to day, depending on whether a hospital decides to keep a patient with COVID-19 who's at ICU level care in the ICU or move them out of the ICU. That could affect the final calculation from the state using the formula for ICU capacity. And so it does vary from hospital to hospital and from county to county based on the surge plans and implementation of the surge plans when it comes to ICU patients. Again, where they place those ICU patients in their facility can impact the actual calculated ICU capacity. So from that perspective, the way I look at this point at the ICU capacity metric is I'm looking again, now that we have, we've had almost a week, but we'll have more as each day passes, we'll have more information and we might be able to look at trends. And the trends I think are what how we're mostly going to be using that ICU capacity metric. Where are we headed? Where have we been and where are we headed? And if it's not heading in the direction that we want to go, is what else? What can we be? What are we doing, and what else might we be doing, or what are we doing that we need to modify to protect our hospitals? So I want people to, folks here, to keep in mind the hospitals are share with us that they're doing what they can with their protocols and their surge plans to accommodate people who show up to the emergency department needing hospitalization or ICU level care. And they'll continue to do what they can, but the hospitals aren't deciding who shows up at the emergency department. Or the numbers of people who show up in the emergency department due to COVID-19. That is determined far in advance. That is determined by transmission in our community. And as long as, unfortunately, as long as we continue to, people continue to gather with households outside of their own household, continue to gather for events, for celebrations, for parties. If people won't cover their face with a face covering or won't keep a 6 foot of distance, that's what's going to drive the rates. That's what's going to drive the cases. That's what's going to drive people who get sick, which determines who shows up in the emergency departments. So for their sake, for the sake of our hospitals and our hospital workers, again, who are just working very hard with this surge in the hospitals, we all need to do what we can. I'm doing what I can, what's within my responsibility as a health officer. Everyone else who's a resident here needs to do what they can to try to slow down the transmission of COVID-19.
Thank you for that. Continuing on with the questions, can you point to any evidence or science that would indicate prohibiting outdoor dining will reduce COVID-19 infection rate, the COVID-19 infection rate?
Thank you for the question. So what we're looking at here in Monterey County is, let me back up. We're always looking for evidence from research. We do have, as a group of health officers, we do have regular meetings to review the literature and the research and the evidence for a variety of aspects of COVID-19, primarily trying to reduce the spread of COVID-19. But we look at other things like how things are going with the vaccines, the type of vaccines. We also look at whether the vaccines are able to reduce infection, reduce spread, and or reduce disease. So there's a lot of things we're looking at. So we're constantly looking for evidence and reviewing literature and looking at the quality of the results. With regards to the spread of COVID-19, and the question was about restaurants, and I appreciate that. What we have right now is experience here in Monterey County. So we know that when businesses and when businesses and patrons of those businesses follow guidance, and we have people in the community staying at home and not engaging with other households, it does have an impact on the spread of COVID-19. Outdoor dining, outdoor dining is one example of a place where people from other households come together and remove their face coverings and spend more than 15 minutes in the same place. And that in itself is what we're trying, discouraging. We know it's as a way of reducing restrictions in a community. That's one of the things that we're working towards. Even though we know it's a higher risk activity, when the conditions warrant it, sure, outdoor dining would be appropriate as one of the first things that we re-implement. However, it still has risk to it, because you have people from other households coming together and mixing without face coverings for extended periods of time. So our experience shows that when we reduce those type of incidents, whether it be outdoor dining, indoor dining, or other sectors where people are coming together indoors from other households for long periods of time, when we effectively do that, we do have an impact on the transmission of COVID-19 as we look, as our experience shows, looking at our case rates over time. So that's what we're looking at. We're looking at basically at this point our experience, but we continue to look for evidence in the literature to substantiate what we as public health professionals have been observing. We're also always looking for the evidence to support our observations over time.
Thank you for that. Continuing with questions, why did the health department wait until ICUs were full to take proactive measures?
So thank you for the question. So as I think I mentioned earlier, we're looking at the state's new order and looking at the criteria that the state established for putting in more restrictions. And so once we had that guidance from the state, we looked at it and realized that, as other counties here in our region realized, that we don't meet the criteria to go into more restrictive state. Each of our counties have looked at and continue to look at our individual metrics and the metrics for the entire region, but not just the state metrics. We're also looking at, as I mentioned, what's happening in each of our hospital systems at the local level. And so the Bay Area counties, in a meeting we had with all of us, a few of the Bay Area counties had reached a point where their bed status and their calculations showed that they would they felt that they would get to a place where they run out of bed capacity sooner and the situation would be more dire if they waited for the state to implement. And so they moved forward, and after a very good discussion among all of us, the rest of us decided that we were going to go back and speak and meet again with our hospitals to reassess where they've been and where they're at now and where they're headed. And so that's why we had meetings with our hospital leadership after the state implemented their orders. I also wanted to take advantage of some time to inform the Board of Supervisors as to what the state had done, what it meant, to make sure they were clear on what the health officer order at the state level was designed to do and when it might take effect, and where we might be based on what our calculation of our own ICU metrics, and also after conversation with our local health officials. And so that's led up to my decision to go ahead and move Monterey County into the more restrictive status before the state tells us to. I continue to be in conversation with the remaining counties that have not moved forward. We are a group of health officers who are committed to working together in this region and supporting each other. And I support the other health officers in their efforts, as the Santa Cruzes, the Napas, the Sonomas, the others, as they look at their own hospital status. They work with their Board of Supervisors and come to decisions that hopefully will continue as a region. We continue to take steps get us to a place where we got reduced transmission and a safer place for all of us.
Thank you. What was the ICU capacity, continuing on the ICU topic, what was the ICU capacity like during previous spikes in COVID-19 cases? And that may be referring back to August when there was a significant rise.
So thank you. That's a good question. I'm curious about that too. So I'm hoping I might be able to find a way to go back and look at that. The challenge is that the ICU capacity metric that the state created has only been around for, well, since the order went and took effect. And that's because the formula that the state is using isn't necessarily a formula that any of us were using. And so we're applying it now. But I don't know that it's that applying that formula retroactively really provides information that will be helpful. And that's because we're at a different place now than we were before. And so, as I've mentioned several times, this COVID pandemic creates the need for, or is changing all the time, and creates a need for us to be flexible and make change along the way, not stay stagnant, do what we need to do based on the information we have at hand and what we've learned from before. And so it will continue to change. We still have the metrics for the case rate and the positivity rate, and we're following it. But since things have changed, at this time, we're not making decisions based on for tier status based on case rate or positivity rate. And that's how much things have changed. Technically, I guess we would still be in the purple tier, but under this new order, we're now using a new metric, and the new metric applies to the current circumstances and what lies ahead. And so, good question. I'm curious, but don't know. That would be very helpful. I think we really need to think about what lies ahead, because we have a lot of challenges ahead to keep our hospitals open, to make sure that our healthcare workers know that we're doing everything we can to support them so that they feel compelled to continue to go to work, continue to do the hard work that they're doing, and to help people and to save lives.
Thank you, Dr. Moreno. Jumping to a couple questions on vaccines. You gave some numbers about vaccine doses that the county would receive. Those numbers, the question is if the numbers are just based on allocations or not what the county will actually get. Is that what we're actually getting or what the state is getting?
Very good question. If you don't mind, I can expand on that just a little bit. So the process that's in place is each hospital is encouraged to create an account with the state system for ordering vaccine, and I'm glad to say that all 4 of our hospitals have done that. Then the state and each hospital has identified their healthcare workers by a risk of exposure to COVID-19 and put them into groups. So we're very happy that they've done that as well, so they know who to vaccinate first. The next step is for the state to determine how much vaccine goes to each county, to the jurisdiction. What the state is doing is they're working with the federal government to determine which portion of the vaccine that's coming to California will go to federal agencies, state agencies, and the remainder going to local agencies. So the federal agencies will receive vaccine directly. So that'd be the federal prisons, for example, and other federal agencies. The state then has a remaining allocation, and a portion of that will go from the state directly to state facilities such as state prisons and state hospitals. What's left is what the state can allocate to the counties. The federal government, I believe, allocated vaccine based on population of each state. So they got a proportion, allocation based proportionally by population. What the state of California is doing is they are implementing formulas that take into account other factors. I believe it takes into account at-risk population, equity, for example, and then making an allocation. So I don't believe it's based just on the size of the population of each county. So that allocation is basically, the state says this is how much you can have if you want it. And so in working with our hospitals, we're determining, and we'll finalize this by tomorrow, how much of each vaccine each hospital is going to get. And they will place those orders. And when they place those orders, we will review them. And if we approve them, that order then goes to the state. That order then from the state, they review it. It goes to CDC, Centers for Disease Control Prevention. The CDC then receives all those orders from the state of California and sends those orders over to Pfizer, and Pfizer will then distribute directly to will forward it or deliver it, to the hospitals whose orders were approved to receive Pfizer. Moderna process is very similar, except that with the Moderna vaccine, I believe the Moderna is subcontracting with McKesson, and McKesson will be actually fulfilling the orders and delivering to the hospitals.
All right, thank you. Do either of the vaccines that have been mentioned require a second dose in a few weeks? And if so, how many people will you be able to vaccinate? Especially since if there's a double dose, you say you get how many doses? And is that a double dose or a single dose?
Okay, that's another good question. So, and hopefully I'll answer the question, the specific question. The state has told us that we can expect weekly shipments of vaccine, which means that we'll be putting in orders on a weekly basis, which means we'll be working with hospitals and eventually other providers to get orders in. Sorry, the question again, Maya?
The question is, do either of the vaccines that we talked about require a second dose?
Thanks.
And then if so, how many get vaccinated?
Right. So thanks. So as those orders get confirmed and the vaccine comes into each hospital, the state has also told us to let the providers know that when those vaccines come in, they are expected to use all of the vaccine for the first dose, to totally use it up for the first dose for all their staff. And so what they are not to store vaccine in anticipation of giving the second dose. And so each of the Moderna and the Pfizer vaccine both require 2 doses. I believe they're a month apart. And so you can see that the first week, second week, third week, fourth week, they may still, if there's anyone left that hasn't received their first vaccine, those people will be getting their first vaccine. But by the 4th and 5th week, shipments will be coming. We're told that allocations will include vaccine for the second dose, for the first dose for providers who haven't received it yet, and allocation for second doses. And so our providers who may still be at different places. Some providers may finish vaccinating all their staff in the first week or 2, and then no vaccine. So no orders may be coming in for them. But then at 4 weeks, they will resubmit orders to provide the second vaccine. There may be some very large organizations that may take 4 weeks to get. In the 4th week, they're still providing the first vaccine to some staff. They will be continuing the first, and they'll be receiving allocation to offer the first folks who got vaccine their second dose. So both of them require 2 doses, but we're instructed to use all our vaccine and get the first doses in first. That's a priority. The second dose shipments will be coming.
All right, thank you. Now, another question this is from a newspaper, so for readers and the public who feel frustrated that they've been asked to comply before, and yet, here we are in the situation with COVID. What is the message to bring people on board with hanging in there for another order?
Oh, yeah. Yes, I totally, I think I understand how much that must be. You've got purple tier restrictions in place and case rates start to go up. We do recognize here in public health that what may have been changing over time and contributing to this is that prior to our current situation, when we were able to, the times that we were able to level off the curve, when we were able to slow down the rise and plateau the rise and decrease case rates, we had systems in place to prevent and then slowly allow more mingling between households over time. But as we continue to do that, the difference, I think part of the difference is back then, people were still uncertain about COVID-19. They may not have really known anyone that got COVID-19, but there were still uncertainty. So a lot of people were not mixing households. They were staying at home. But over time, I think people in a situation like this do feel the urge to make some exceptions and leave their home for other reasons, not for shopping, not for doctor's appointments, but to mingle with people that don't live with them. And in talking to my public health staff that are working directly with cases and interviewing them as a part of our routine public health case investigation, we are getting people who are telling us that they know yes, they did. They met with people outside their household for different reasons, and they just felt the need to do it, and they got sick, and others got sick, and some people some of them are in the hospital, and they know they shouldn't have done it, but they did it anyway, and regret having done it. So I think at this point, one of the things that's contributing to the rise that we didn't have as much of in the past is people leaving their homes to mingle with other people who aren't in their household. And so that's something that we're hearing more anecdotally through our case investigators, and some people are admitting it. We still have people who, even though we do our best to reassure them in whatever culturally appropriate and linguistically appropriate manner we do for that person, for that case, we do tell them, we need to know so we can inform you of, who you might have been in contact with and maybe who you exposed. We think are mingling with other households, but won't share that with us. But we do tell them, even though they may deny it, we do tell them that it's very important that people should not be mingling with other households. So I think that's contributing more now to why we're to this increased resurgence of COVID-19. And the other thing I want to also share, if we have some time, is that when we look at the close contacts that are getting COVID-19, these are people who didn't have symptoms, but they were with someone who had COVID-19 when they're infectious. We're still seeing a lot of people who are getting affected in their households, and this is something that may also be partly due to the cooling weather. As people move shorter days, cooler weather, as people spend more time indoors, the risk of transmission if people can't isolate, and we know that people struggle to isolate, and the counties has some strategies and programs to help people isolate, and we're developing more, but people who can't isolate are potentially exposing household members who are also spending more time indoors because of shorter days and colder weather. So that's also, I think, contributing to rising rates. So there's a lot of things going on, Maya, that during this pandemic and during this time of the pandemic that could explain why we got increased rates. So for those business owners who are currently under restrictions and looking at ongoing restrictions, the additional restrictions aren't, there is no single cure for this. There's no single answer. There's no single strategy that's going to work. It's a combination of strategies. And I think it's really important that everyone in Monterey County, or anyone that visits Monterey County for essential reasons, essential services and other permitted reasons, do our part, know what our role is, and do our part to reduce the transmission. That includes the business sectors, that includes public health, but that includes people who aren't in the various business sectors, people who every day have the choice of staying at home and preventing exposures and not bringing COVID back into their household. That's the decision that needs to be made, and people need to do that, especially now. Stay at home.
All right. And actually, just here's a question that includes some of the discussion. You mentioned retailers. Beyond retailers allowed to operate at 20% capacity, could you point to any specific difference between the first shelter-in-place order in March and this shelter-in-place order?
Right. So I would say there are some differences, Maya. The difference was back in the beginning of this pandemic, we did not know as much as we know about the virus and about transmission and about morbidity and mortality, who's going to get sick and who's going to die from it. So we have experience now. So that's I think one of the differences I want to point out. And using that information and the data that we've acquired over time and the trends that we've seen and the impact of restrictions and guidelines that are implemented appropriately, we're looking at this at slightly different than at the beginning of the pandemic, Maya. And so one thing that we're learning is that there are circumstances where we may be able to reduce capacity rather than completely shut down a sector. So the example would be retail. So there was retail in early on in this pandemic during the first shelter in place where some retailers were shut down altogether. That does reduce transmission. However, it has an impact on that business and the people who work there and people who are looking for the services of that business. So with there is evidence to suggest that we can achieve a reasonable balance by reducing capacity and not shutting down altogether. So the 20% capacity for retail and 30 rather than shutting down retail looks at some evidence that suggests that if you shut down to say 20% capacity at a business, you can still reduce the risk of transmission by a significant amount. So you reduce transmission without completely turning off, shutting down the business. So I think that's one of the differences we have in this order. Rather than all or none, you're open, you're closed. It's you're open, follow the guidance and do it, but you're open and do what you need to do because you're part of the critical infrastructure. And then there's the other group that's you're open, but you have certain restrictions, where you can operate, hours you can operate, what kind of service you can provide, limited services, or you're open, but your restriction is decreased capacity. And if you want to stay open, you have to follow decreased capacity. And then there's the other group, which is the need to stop the service altogether because of the risk. So I think that's part of the difference. It's more of a spectrum of restrictions that we have this time compared to last time.
All right, I'm going to try to sneak in one more question for you before we wrap it up, maybe at 4:30. And we were just talking about retail again. Since these shutdowns are so devastating to so many small businesses, is there any glimmer of hope that you can give businesses who are going to have to, make changes again and make it through another time of restrictions?
Yeah, yes, I think there is some hope. I remain hopeful every day that we find that we're observant, we're empathetic, and we're using the data that we have available us to inform our decisions. I'm also hopeful that based on those decisions and recommendations and requirements that we all realize that the response to this COVID-19, well, the COVID-19 pandemic is changing in and of itself, but our response continues to change and continue to adapt as we move forward. And as people are reducing the level of service, reducing staffing perhaps, and if they have to shut down, take advantage of this opportunity to not go outdoors and find other ways to spend your time that promote transmission. Stay at home as much as possible, and encourage your family members, your friends to also stay at home during this time. If you're a business owner and you are shut down completely for the next 4 weeks, or shut down or have these additional restrictions, and you want to reopen, and I want you to reopen, and you want to remove the restrictions as soon as possible, that's part of that's going to depend on whether the rest of us who are not the business owners, not the employees of these businesses that are shut down, the rest of us need to do our part if we want to see these businesses reopen with fewer restrictions or reopen at all. We have to do our part to stay at home and not mix at gatherings, and not meet with people from other households for the various reasons that we've been doing so, particularly the holidays. So I hope that all of us will realize that the way at this time, if we're going to reduce transmissions and reduce illness and reduce fatalities, is by following the same recommendations that have been in place for some time now, and that's how we're going to get there. I also have hope that the vaccine will begin to impart additional immunity within our community, and that all of our hospitals and when the time comes, our skilled nursing facilities, and when the time comes, our other essential workers and primary care clinics will also promote the vaccine and provide it to their employees in an informed manner, so that all of our employees understand what the vaccine is, what the vaccine does, the safety of the vaccine, potential side effects of the vaccine, and the overall benefit of a vaccine program on our community. And that's also going to contribute to a reduction in transmission as well. Yeah.
Thank you. And we've got to let Dr. Moreno go on, and we're going to let him go on that kind of a hopeful thought, and wrap up our media briefing on that hopeful note. Thanks for joining us on this, for this impromptu hour. We appreciate it. And thank you, Dr. Moreno, for joining us.
Sure.
See you next time.
My pleasure.